All right, so I got Mr. Rodney here with me today, and I just wanted him to talk about his story and how everything's going for him for the knee program so far. So, Mr. Rodney, what's going on, and how's your knee doing?
Well, when I first came in last week to start training or start rehab on the knee, I had perpetual pain in both feet, numbness, tingling, and the perpetual pain was in the right knee. Since I began therapy, I have lost most of the tingling, the numbness in both feet, and the pain in my knee, which was constant, is very sporadic at this point. So I've noticed the swelling going down in the joint, as well as just day-to-day walking in the office. Nowhere near the same discomfort that I had just 2 weeks ago.
So since you've noticed some good changes so far, what are your biggest long-term goals?
Biggest long-term goal is to get this knee rehabbed enough to where I can start exercising a little more rigorously, whether it's in the gym or whether it's in the neighborhood, to allow me to do that without taking painkiller every time I have to do something, whether it's hiking, biking, or whatever it is.
So have a lot of hope for you so far since we just started with everything. So we'll check back here in a couple weeks and go from there.
Thank you.
All right.